Some folks talk about the cost of bariatric surgery. I like to look at the cost of bariatric surgery as you're weighing between the actual financial cost versus the long-term cost of being overweight or suffering from the disease of obesity. On the average, the amount of money you spend on your surgery is much less compared to the long-term costs you're going to incur if you do develop any of the diseases associated with obesity. The medications that you have to purchase, to the doctor's visits, to the possible hospitalizations, possible procedures you might have to do, all of these add up. And with treatment for obesity, very often these are covered by your insurance. And we will do the work for you, confirming from your insurance what is covered, how much it's going to be out of pocket. We do all that math for you to make it easier for you, to let you understand that this procedure, whichever one you choose, is usually affordable. Also, we do have some options for you that could help to reduce the cost of surgery, especially if your insurance does not cover it. So what I would say is, if you're thinking about it, do come on in or sit down or have a talk and see how we can help you to get healthy. We wouldn't want just the cost of the surgery to be an impediment to your health. What are the requirements for weight loss surgery? Very often this is dependent on your insurance policy. Here at TGA, we do all that work for you. We will call your insurance company, find out the insurance policy, what the requirements are, and we'll let you know. On the average, for most policies, they do require a certain number of monitored dietary visits. Basically, visits where you come in, we'll talk to you about your diet, talk to you about your exercise, and to check your weight to see how you've been doing. This ranges usually from 1 to 12 visits, and like I said, it's dependent on your insurance. Another requirement that most insurance policies do have is a weight history, where they ask for your weight, what your weight has been for the last 2 to 5 years. Now, this weight history can be something as simple as you walk in to see your primary care physician or your PCP, or for our female patients, a visit to your GYN to report your weight. That's usually all that we need. Another requirement very often seen is a psychological assessment. Now, this basically is for you to see a psychologist, and we would arrange one for you, so you don't have to worry about that. Where you sit down and talk with the psychologist is really trying to assess for you to understand that the process is a lifestyle change and nothing else. All of this aims at trying to make sure you have success with your weight loss afterwards. Another requirement that some insurance companies do have is a drug screen. This is because they don't want a situation where patients who have a history of drug use do have the surgery, because unfortunately these patients have a higher risk or chance of not having success. If you're still thinking of weight loss, considering bariatric surgery or weight loss surgery, give us a call and we can help you take most of this work off your back.